Thank you, Lunar Ridge listeners. This is your hour of beloved French composer Erik Satie. Now we are moving on to one of his earliest compositions, Gymnopedie number 1. Enjoy.
Good day to you. How have you been faring lately? Yes. I understand that you've been experiencing some sensitivity of your nerves. Okay. Well, we'll see today if we can figure out the cause and also bring you some comfort too, okay? Alright. So if you don't mind, I would like to ask you a couple of questions just to figure out what the root cause of your sensitive nerves are. Okay? So the first thing is, have you been feeling overwhelmed lately? Okay. There are a lot of different sources of overwhelm. It can be from your current environment, relationships, a work environment, so it's very, very common. Have you been feeling a sense of sleeplessness, difficulty falling asleep, or difficulty staying asleep as well? Waking up at night and not being able to return to a peaceful rest. Okay? Difficulty sleeping could also not be related to nervousness conditions, nerves. It can also be your current environment. If you have loud neighbors or there's a lot of light in your sleeping environment, can also affect sleep too. Okay, so those are some things to consider too if you are having this restlessness and difficulty sleeping. How has your heart been feeling? Any quick pace? Okay. Have you been experiencing any limb or finger tingling or sensitivity? Maybe some types of strange sensations happening. Okay. How about any dizziness? Have you experienced dizziness? Maybe even when you're standing up. Have you, let's see, experience the sense of spinning. Not connected with any alcohol consumption. That's good. And how has your diet been? Are you eating a lot of rich foods? A lot of milk? Very important to drink a lot of milk. How about meat? You're eating enough meat, enough protein sources, good protein sources. Are you eating breakfast in the morning? Healthy breakfast, oatmeal. Very important to maintain a stable mood, stable nerves throughout the day. At least that's what I recommend. Okay. So make sure oatmeal is on the ticket for breakfast every day. Okay. So I like to do a couple of tests, of course. I like to check your nerves themselves with some sensitivity tests, and I would also like to check your heart to make sure that that's not a contributing factor, okay? So I'd like to listen to your heart now. Okay, just going to give a listen to your heart. Just lift your shirt up a little bit. Just want to make sure that it's not too cold. Rest your hands down by your sides. Good. And breathe normally and just try to relax. Your pulse is just a tad elevated, but it's normal when you're by the doctor. Very clear. And I also like to check your blood pressure too, just to make sure that is stable. Get the blood pressure good. Okay. Sounds like your heart is pretty strong, but let's check your blood pressure just to be sure. Let's see. Let me get your left over here. Just move up the arm of your shirt, please. There we go. You can rest your wrist right here. You are in the normal range for sure. Maybe a little bit high right now, but that's definitely going to come along with the nervous conditions. So, a couple more tests. You can definitely rule out anything with your heart. Your heart is quite strong, so don't be nervous about that at all. Now, I think it's also relevant to check your eye response. Sometimes with nervous conditions, it could have a relation with vision. If your eyes are tired or very sluggish to respond to light, that can be a sign there's something deeper happening that we will want to do further tests on. So let me check your light sensitivity right now. So just look right at my nose. Good. I'm just going to point this light close to your eye and see how is your eyes responding. Going from all angles. So far it looks like your eyes are responding. Both the left and the right eye respond equally to light. That's a good sign. There isn't something happening on one side that's different from the other one. Right? So now I would like to ask you to just follow the light with your eyes. Keep your head stable right there, looking forward, and then follow the light with your eyes. Okay. Okay. Very good. Now I'm going to go in from the corner and down into the center. Like that. Very good. Are you feeling any difficulty with this exercise? Sometimes the eyes can get very tired with that nervous condition, so If you're feeling like it's a struggle to follow the light, that's totally normal. But from what I see, you did really, really well with that. Alright? Do you use any corrective frames? I see you're not wearing them right now. Okay. Just going to note that down in my notebook, that you have good light sensitivity and also strong eye muscles. And also that your peripheral vision is within the normal range. Okay. Now, let me just check your temperature to make sure that you don't have an elevated temperature. Just going to feel your forehead. Okay, good. It feels very normal, quite cool to the touch. You're not feeling any sense of strange pins and needles sense or hallucinatory sense. Okay, good. Okay. Next, I would like to check your throat. So, please open your mouth and say ah for me. Just going to push your tongue down a little bit so I can look at the back. Okay, good. Just going to check again. Make sure there's no signs of inflammation. Good, good. I don't see any signs of inflammation there. Next, I'm just going to feel a little bit around your neck. You've been making sure to include some iodized salt into your diet, right? I know it's been out for a couple years now, but some people are a little bit paranoid about it still, but there's no need. Iodized salt is a very, very important part of the diet. I recommend it for all of my patients. No signs of anything. Anything strange happening in your neck here? Let me just feel without the gloves. It's become a new practice in medicine to use gloves more often, but feeling any pains anywhere that you would like to tell me about? Okay, that's good. Next, I would like to do a little bit of a sensitivity test. I have a very soft cotton ball and also a more blunt instrument that I will use to touch you on various points. And I want you to tell me when you feel the sensation. So for this, I'm going to ask that you close your eyes. Okay. Let me do a small demonstration first. I'm going to touch you with the cotton. That's what the cotton feels like. And I'm going to touch you with the blunt end. That's what the blunt one feels like, okay? You felt the difference, right? Okay. So let's start. Okay, good. And was that blunt or soft? Yes. Okay. Okay. Fantastic. Good. Good. Right. Yes. Now I'm going to do the test on your face. So, same thing. But this time I want you to tell me where I'm touching. So if you feel the sensation on your forehead, just say forehead. On your chin, and so on. Okay. Alright. Alright. Yes. Good. Right. Yes. Okay. You can open up your eyes now. Okay. So, your nerves are well within the normal range of sensitivity. It's actually quite normal to have heightened sensitivity of the skin with a nervous condition, so that's it, to be expected generally. With this type of extra sensitivity, I really recommend that you don't use too much soap when you're cleaning your skin, and avoid brushing your skin too hard in the shower or in the bath, because that can just make it worse for you and make it more uncomfortable. So that's really important. So let's just review the tests we did here with your questions, and we found that you have a strong heart, you have a normal light sensitivity, and your eye muscles are strong. We didn't feel anything happening with the neck, and we don't see any signs of fever, so no sicknesses with that. Your peripheral vision is good, and your sensitivity of the skin is quite responsive and normal, within the normal range. So I haven't discovered some type of underlying condition. So what I'm going to recommend is some time outside, some time in nature. Nature is very healing, and getting some nice fresh air into those lungs can really help to calm and slow the heart rate, because you did have a little bit of an elevated heart rate. So getting outside in some green areas, taking a deep breath of fresh air can really help that condition. I'm going to write everything down too so you don't forget. So fresh air, very, very important. I also want you to relax from strenuous activities and excessive work. Work needs to stop for the day at 5 p.m. No working past that, okay? This will help with any feelings of overwhelm with work and life. It's really important for you to have more sleep, more time to sleep. So at night, no more late night reading. Calm yourself down late, 8 to 9, and get a really good deep sleep every night. So 8 to 9 p.m. calm time. Less work. No work after 5. And fresh air multiple times a week. And no extra weekend work, okay? I also have something to give you. This is a nerve tonic. As you can see, it's got highly concentrated levels of valerian and chamomile, which are amazing for calming, resting, and also getting a really good night's sleep. So what I'm going to recommend for you for a dose is 1 small teaspoon in the morning, and that should help calm your nerves for the rest of the day, okay? If you're feeling like in the evening your sensitivity is escalating and you're feeling not so good, you can take another half teaspoon before going to sleep. That should help you fall asleep nicely, okay? You may find that you will have quite vivid dreams with this tonic, but that's quite good because you can go into your dreams and you can discover what is the cause of this nerve sensitivity. You will find sometimes that those reasons will reveal themselves in your dreams, and in the daytime you can kind of work through them then, okay? So let me write that down for you. So the nerve tonic is 1 teaspoon in the morning. And half teaspoon at night as needed. I know that nervous conditions can be really troubling, but if you avoid stress, take my recommendations, and especially take your nerve tonic every day, I think you're going to start feeling back to normal again. And if in a couple weeks' time you're feeling like these things aren't working, we can arrange a stay for you in one of our sanatoriums where you can get some medically authorized rest. Okay? But for now, let's try all of these recommendations and see what happens and see if you get better, okay? Alright, so here's your recommendations and your prescription and your nerve tonic as well. Here, no need to go to the drugstore. If you need any more of the nerve tonic, let me know and I can run a prescription over to the drugstore for you, okay? Alright, great. Alright, good luck and I hope you feel better.